Progress.
Welcome to Kaiser International Health Group Inc. Retirement Healthcare Investment Orientation. So my name is Financial Coach Jane Schildhabel, Associate Financial Planner and Life Insurance Passer. So welcome po sa ating Kaiser Orientation. So let's welcome our Kaiser Ambassador, Mr. Daniel Padilla.
Someday, you will get older, slower, grayer, but also wiser, calmer, and freer than ever. At Kaiser, we help you prepare for those years ahead so you can keep doing what you love with the people that matter the most. Prepare for your future today.
Yan po yung Kaiser natin. So every person needs two healthcare. One is short-term, individual or group policy for a specified hospitalization coverage para sa inpatient and outpatient. Healthcare coverage for 1-year-old up to 60 years old. This is while we are in our nasa employment pa po tayo. So we are covered by our employer. Yung second naman is long-term healthcare. Individual policy and investment solely dedicated for your medical needs upon retirement. So healthcare coverage from 61 years old up to 100 years old. Best if policy will start an early age to allow compounding of healthcare investment coverage of 3 to 10% per annum. That is Kaiser Long-Term Healthcare. So introducing to you Kaiser International Health Group Inc. is a health maintenance organization company duly accredited with the Department of Health, Bureau of Health Facilities and Services. Our company is likewise registered with the Securities and Exchange Commission on June 8, 2004 as a healthcare provider with authorized capital stock of 160 million. So we are the provider of Department of Agrarian Reform, Supreme Court, House of Representatives, Philippine Coast Guard, at marami pa pong iba. So for us, tayo individual, we can also trust Kaiser because our government also trusted Kaiser, di ba? So Kaiser International Health Group Inc. is also offering one-of-a-kind HMO product, the Premium Healthcare Builder Plan. This is geared towards our long-term care. So we have the ultimate Kaiser Health Builder. So 7 years to pay and 13 years to wait, total of 20 years. It is designed to provide healthcare beyond that of an HMO. Allows us individuals to save during employment while still being covered by company's health plan. It is addressed for a long-term healthcare needs for us, especially after employment and retirement years. Pag nag-retire na tayo, wala na tayong trabaho, at least nandyan si Kaiser na in case magkasakit tayo or ma-hospital tayo. Securing a more comfortable elderly life. As I said, 7 years tayo magbabayad kay Kaiser, 13 years to wait, total of 20 years. So, Kaiser, long-term healthcare is 3-in-1 na po siya, parang kape lang, di ba? So may healthcare na, may life insurance, and may investment na din. So, introducing Kaiser Ultimate Healthcare Builder, 13 years to wait equals 20 years. So, renewal is guaranteed kasi long-term to. So, once na-approve na yung policy mo, renewal is guaranteed. Fixed premium for 7 years. Kung ano yung binimayaran mo ngayon, for the total of 7 years, the same pa din ang pagbabayad mo sa premium mo. So with 4-way insurance coverage up to long-term care plan naman natin. May term insurance siya. In case namatay tayo for natural death, may makukuha na term insurance yung pamilya natin. Accidental death naman, times 2 ang makukuha ng pamilya natin kasi term insurance plus the accidental death insurance. Yung dismemberment naman, if nawala ng dalawang paa, dalawang kamay, or mata yung policy holder, so mawi-waive na din yung pagbabayad. And waiver of installment due to death. Diba kasi namatay na yung policy holder, so wala na magbabayad. Makukuha yung term insurance sa pamilya, sa beneficiary, And then, matransfer pa yung policy sa beneficiary. Waiver of installment due to permanent and total disability. So for example, nakoma na yung policy holder, hindi na makapagtrabaho, di ba? So, mawi-waive na po yung pagbabayad ng Kaiser natin. But, hindi pa yan. So, we need to pay first 180 days or 6 months kasi nga, imbestigahan pa ni Kaiser kung totoo ba talaga yung claim natin na disable or na permanent at total disability. Once mapatunayan, mawi-waive na yung pagbabayad ng Kaiser. So all unused health fund accumulates of interest. Kasi you are healthy, hindi mo pa kailangan, hindi ka nagkasakit. So yung fund natin nag-accumulate po siya kasi it is invested sa mutual fund. With return of premiums up to 85% of the contract price. So wala tayong ginamit during the 7 years na nagbabayad tayo. 'Di ba? So which is good kasi we are babalik sa atin 85% on the 20th year. On the 20th pa, hindi yung sa 7 years mo kukunin mo na, no. Kasi it is still invested sa mutual fund. So on the 20th year, makukuha natin yung 85% of the contract price. So covers beyond that of 60 years old with long-term care yields. Kasi nga, for example, if you're 22 years old, tapos 20 years si Kaiser, so nag-mature siya in your 42. Hindi mo pa kailangan kasi you're still healthy, you're still young. So pwede pa siyang cover beyond of the age 60, di ba? Or kumuha ka 60 years old up to 75 years old or 80 as long as may funds po tayo. Pre-existing is not covered during accumulation. So for example, may asthma, may diabetes, may hypertension, hindi po yan covered yung mga pre-existing illness. Pero covered na siya after the 7 years after nating magbayad ng ating Kaiser. On the 8th year to the 20th year, pwede covered na po lahat. It's also flexible, transferable, and upgradable. Flexible po siya kasi we have may mode of payment po tayo. Monthly, quarterly, semi-annual, or annual. Transferable po siya once na wala na yung policy holder, matra-transfer po yung policy holder yung plan sa policy beneficiary niya, 'di ba? So pag nawala na yung policy holder. And upgradable, so for example, kumuha ka ng plan K45, ikaya mo pala ng plan K100. So kumuha ka within 30 days. So pwede po 'yon. Pero hindi ka na pwedeng mag-downgrade. So for example, nag-monthly payment ka tapos ginawa mong annual payment. So pwede po 'yun, upgrade, pero hindi po 'yun pwede mag-downgrade. So reinstatement within 2 years of lapse policy and maybe redated benefit design. So may chance po tayo na reinstate natin yung plan natin. So for example, hindi ka nakabayad kasi nawalan ka ng trabaho. So maybe within 6 months, pwede mo pa yun reinstate. So magbayad lang tayo ng 300 pesos. So we have two ways, i-redate natin or i-update yung plan natin. Yung update yung plan natin, may bayad po siya ng mga charges, surcharge. Yan po. So 7 years lang tayo magbabayad sa ating Kaiser or magsisave sa ating Kaiser. Or pwede din natin spot cash payment options. So here we have the example na Ultimate Kaiser Health Builder, yung plan na K100. Yung spot cash na 411,750. Annual payment 58,821. And monthly niya 5,882. So yung annual nakasave na tayo ng 2 buwan kasi times 10 lang yan. So 5,882 times 10, that is 58,821 lang. So for example, age 22 ka, kumuha ng iyong Kaiser. So 7 years ka lang magbabayad, so up to age 29. So for this period, this is what we call the saving period. From the 8th to 20th year naman, that is what we call the extended period. So while we are paying, may mga benefits din tayo. So first is annual physical examination benefit. After natin magbayad ng 1 year sa plan natin, so pwede na tayong magpa-CVC, chest x-ray, annual physical exam, fecalysis, urinalysis, ECG, and pap smear for age 35 para sa females. So dental benefits din, yung mga simple tooth extraction, pero yung minor adjustment ng dentures, pero hindi na yung full set of dentures. Waiver of installment due to death. Yun nga, if nawala yung policy holder, so for example, on the second year niya, na nagbabayad ng Kaiser at namatay due to natural death, diba? Makukuha ng pamilya yung yung plan or yung term insurance, 'di ba? So mawi-waive na yung pagbabayad din ng beneficiary kasi nga nawala na yung policy holder. So waiver of installment due to disability. So ito din, as we say, pag na-disable, nawala yung dalawang kamay, dalawang paa, yung mata, kasi 'di ba, that is very important for us, yung eyes, hands, and feet. Kaya mawi-waive din yun pag na-disable. But kailangan muna bayaran natin for 180 days or 6 months para mapatunayan natin na totoo talaga yung claim natin. And inpatient benefits or hospitalization din. So members' choice of room and board. So annual benefit limit for this plan na K100, that is 60,000. So yung lower plans din 50,000 lang. So if we want na higher annual benefit limit, so we can go higher plans din. So term insurance for 20 years. Kasi nga yung plan natin na Kaiser is 20 years. Accidental death and dismemberment for 20 years. If nawala due to accident, doble ang makukuha ng beneficiary kasi term insurance plus the accident. So that is for this plan na K100, yung term insurance nito is 450,000. Plus yung accidental death benefit na 450,000, that is 900,000 yung makukuha ng beneficiary. And we have lifetime network access of over 500 hospitals and 1,000 doctors as long as may fund po yung Kaiser plan po natin. So from the 8th year to the 20th year, tinatawag naman natin itong extended period. So K100 yung plan natin. So 10% yearly benefit. So 10% of 100,000 is 10,000. So every year meron tayong 10,000. So total niya yan, kasi 13 years from 8 to 20, that is 130,000. But because if hindi natin ginamit, nag-accumulate siya niyan. So from year 8 natin 10,000, year 9 natin, di ba? 10,000 plus 10,000, that is 20,000. Nag-accumulate siya, may 1,000 siya. So 21,000 and so forth and so on. So total amount is 269,750. And may yearly bonus din tayo, yung dividend. Kasi nga, as we say, Kaiser is invested sa mutual fund natin. So nag-a-accumulate din siya. So total for over the 20 years, that is 446,419. So long-term care benefit upon maturity, this is yung plan natin, K100, that is 100,000. This one, we will receive it on the 20th year. May claiman tayo during the paying period or dito. So, ibabalik po yan sa atin yung 100,000. Long-term care upon maturity if no claim during the 7th period. So, mayroon po tayo for this plan na K100, 85% of 411,750, that is 350,000. So if wala po tayong na-claim during nagbabayad tayo, 'di ba? Kaya dapat if healthy tayo, 'di ba? Huwag natin gamitin muna, or if kaya naman natin munang bayaran from our pocket, so bayaran muna natin. Kasi kung ma-minus yan ng 5,000 during the nagbabayad tayo, sayang yung 350,000, 'di ba? So total nito on the 20th year, meron tayong maturity value na 1,166,169. So saan pa tayo? More than double po yan sa binayad natin na 411,750. So kaya ang Kaiser talaga is ipon na walang tapon. Kaya kumuha na po tayo. So as we say, Total accumulated unused health benefit on the 20th year is 269,750. Long-term care bonus or benefit, this is our plan na K100. So, babalik yan sa atin ni Kaiser on the 20th year. And long-term care bonus, if wala tayong claim during the accumulation period or paying period. And then additional health benefit via dividend form kasi nga Kaiser natin is invested sa mutual fund. Meron po tayo 446,419 total of 1,166,169. So yan po yung makukuha natin on the 20th year. But depende po yan sa atin kung gusto nating ikunin na during the maturity or stay pa lang natin dyan. So if stay lang natin kasi age 42, bata pa siya, di ba? At the age 60, if stay pa lang niya yung Kaiser niya dyan, so yung funds niya, so magiging 6.4 million. Pwede siyang kumuha or kumirot ng 10%, that is 640,000. Or at the age of 65, naging 10 million na yung pera niya. 'Di ba? As we say, kasi si Kaiser is invested sa mutual fund, nag-grow pa din, nag-i-interest pa din yung pera natin. So if possible, pwedeng kumirot ng 10%, that is 1 million. This is what we call money working for you. So saan pa tayo will get our Kaiser para we have our healthcare, life insurance, and investment na kaagad, di ba? So eligibility nito is from 10 years old to 60 years old. From 10 to 40 years old, pwede silang kumuha ng plan K45 and up. Yan po yung pinaka babang plan natin. 41 to 50 years old naman, this is K60 and up. And then 51 to 60 years old, yung K75 and up. But if you want 1.1 million and above at maturity on the 20th year, so kumuha po tayo yung age to 10 to 60 years old if we get plan na K100 and up para may 1 million po tayo. So these are the plans ng ating Kaiser. So up to 1 million po yan na plan. But depende sa atin kung anong plan na kukunin natin. So we can have a mode of payment, monthly, quarterly, semi-annual, and yearly. And ito yung mga maturity amount niya na makukuha natin on the 20th year. So may policy fee po tayo na 500 pesos every year for 7 years. Or total niya 3,500. Kasi nga, yung policy plan natin is 3,500 but we are paying 7 years ng Kaiser natin kaya dinivide po siya ng 7. Kaya 500 pesos every year po yung babayaran natin. And this is our plan. I-open lang natin yung portal natin, OPMS natin, at makikita po natin yung mga benefits natin dyan. And meron na po tayong makukuha after mo ng 7 years, you will have your certificate of full payment and yung makikita mo din yung maturity date kung kailan. Yan. And may Visa card po tayo. So marami na po ang nakakuha ng benefits ni Kaiser. Yung mga death claims, meron na po tayo, especially during the pandemic. And may nakakuha na din ng maturity benefit nila. This is our CEO, Lyndon Malanog. And marami na pong iba. So sa 6 steps in building a solid financial foundation, we already answer yung tatlo. Yung healthcare, fund, yung life insurance, and investment. So ano na lang ang kailangan natin? We need to increase our cash flow, pay off our debt, and create emergency fund for us to have a strong strategic game plan para ma-build talaga natin yung solid financial foundation natin. So financial independence can be a decision, not a dream. Learn how money works to learn how to earn it and grow yung cash flow po natin. So saan ba tayo dito? Dito ba sa naka-blue or dito sa nakapula? So, don't be a slave of money na magtrabaho tayo until the age 65. So, we make money work hard for us, di ba? Kasi ang pera, pag nagtatrabaho, hindi kasi yan nakakasakit. Hindi, pag nag-holiday tayo, at least hayahay tayo. Yung pera natin, papasok pa din sa bulsa natin, sa bangko natin. Kaya, let's work smart. Yan. So financial education is not just for the wealthy, it's for everyone. So sabi ni Swan Nguyen, This book is helpful for people who want to move from financial insecurity to financial security. It is the first step toward a better financial future and possibly becoming financially independent. Sabi din ni Brother Bo Sanchez, friend, this book is your ticket to upgrading your financial life. Read it, devour it, and share it with people who need a financial revolution in your life. Yan po.